Picture this. It's a quiet evening in Berlin. Sophie, 72, leans back on her couch, a gentle sigh escaping her lips. She feels a strange heaviness in her ankles, like little balloons slowly inflating under her skin. She jokes to her husband that she's become a balloon on wobbly legs. But deep inside, she wonders, why are my feet so cold even though the apartment is warm? Why does my sock leave a dent that won't go away? If Sophie ignores it, she might be missing a whisper from her heart that's turning into a shout. And this isn't just Sophie's story. It could be yours, or someone you love in Rome, Paris, or Madrid. Because when the heart falters, it doesn't always send the classic thunderclap of chest pain. Sometimes it sends gentle signals in your legs and feet. Today, we're exploring 12 quiet alarm bells of congestive heart failure that many seniors overlook, especially in the lower limbs. We'll walk through each symptom, explain why it happens, share relatable stories from everyday European life, and highlight when you must act. If you're watching this in a small flat in Lisbon, a countryside home near Vienna, or simply checking in on your mom's health in Stockholm, this video matters. Stay with us until the end because a few minutes now could add years later. Hello friends, welcome back to Wise Well, your warm, trustworthy space for senior health, smart insights and a little lightheartedness too. I'm your host, and today we're diving deep, but gently, into something critically important, the body's telltale signs of heart stress, especially in your legs and feet. Why focus on the legs and feet? Because for many seniors, the big dramatic warning lights, like chest pain or collapse, never show up. Instead, subtle signs appear in places we rarely think about. Our aim is simple. By the end of this video, you'll be able to spot 12 warning signs, understand why they show up, know when to visit your doctor, and feel empowered, not anxious. So make yourself comfortable, maybe put your feet up like Alex in Paris after a long day, and let's walk this path together. Imagine a well-oiled pump, your heart, that pushes water through a garden hose, your blood vessels. If the pump weakens, water backs up, and the lowest point in the system, the hose lying on the ground, starts to leak. In your body, when the heart can't pump effectively, blood and fluid start to pool, especially in your legs and feet, thanks to gravity. That pool becomes swelling, heaviness, coolness, and color changes. So yes, a swollen ankle or persistently cold feet might not just be getting old. It might be your body whispering, check my pump. Before we list the 12 symptoms, a quick note. None of these automatically mean heart failure. But taken together, especially if you have other risk factors like high blood pressure, diabetes, or previous heart disease, they're red flags. Better safe than sorry. 1. Persistent swelling of the ankles, feet, or calves that leaves a dent when pressed, also called pitting edema. Luca in Rome notices his socks leave deep marks by midday, like the socks are hugging too tight. He dismisses it as just my circulation, until one morning he must ask his wife to help him put his shoes on. Fluid is building because the heart isn't moving blood effectively. The backlog leaks into the tissues. If swelling persists beyond a day or two, especially in both legs, don't ignore it. 2. Sudden weight gain of 2 or 3 kilograms in just a few days with no change in diet. In Berlin, Sophie steps on her scale after a weekend in the countryside and finds her weight has jumped. She assumes it's gelato and wine, but she also notices her boots feel tighter. That's fluid retention, your body holding water, not fat. If it's unexplained, call your doctor. It may be an early sign. 3. Leg heaviness or a dragging sensation when walking, especially at the end of the day. Alex in Paris jokes that his legs feel like 2 bricks after an evening stroll along the Seine. He thinks it's just aging. But it's more. Poor circulation from a weak heart means muscles and tissues aren't receiving enough oxygen-rich blood. They fatigue faster. If you used to walk easily and now your legs feel heavy for no reason, get it checked. 4. Cold feet or toes even when the room is warm, sometimes with a bluish or purplish tinge. Marie from Lyon wraps herself in blankets but still complains her toes feel like ice. She ignores it until she learns that cold lower limbs can signal heart problems. Reduced heart output means less warm blood reaches the extremities. Especially if combined with swelling, see your doctor soon. 5. Frequent or unexplained cramping in the calves or thighs while at rest. Giorgio in Milan sits on his balcony with a glass of wine when his leg suddenly cramps up. Maybe just old age, he thinks, but paired with puffy ankles, it's worth attention. Tissues deprived of oxygen and nutrients due to poor blood flow can cause cramps. If cramps become daily and unexplained, talk to a doctor. 6. When you remove your shoes, the line from your sock stays embossed on your skin and gets worse by evening. Eva in Stockholm removes her boots after dinner and sees a clear rim around her ankles. She assumes the boots are too tight, but the mark stays even after she changes shoes. Fluid is sitting in the tissues. The indentation is the footprint of fluid overload. Elevate your legs, monitor if the rim deepens, and seek help if it does. 7. Stretched, shiny, or tight skin over the lower legs, sometimes itchy or tingling. In Barcelona, Ramon notices the skin above his ankle feels like plastic wrap, shiny and strangely itchy before bed. He wonders if it's a rash. Fluid stretches the skin and tissues, reducing elasticity and irritating the nerves. Visit your doctor if you notice changes in skin texture. 8. Unexplained muscle weakness in the thighs or calves, especially when trying to stand or climb stairs. Ingrid in Copenhagen wakes up one morning and her legs feel like mashed potatoes when she tries to get up. She blames bad sleep. When the heart can't pump enough, muscles get less oxygen and fatigue quickly. Don't ignore it, especially if it comes with swelling or cold feet. 9. A feeling of leg fullness or tightness that worsens when standing and improves after resting. Paulo in Lisbon spends a morning watering his garden, and by noon his thighs feel like they're carrying sacks of potatoes. He sits, elevates his legs, and it eases, but it comes back tomorrow. Fluid pools in the legs from gravity and a weak heart. When you rest and elevate, it improves. If it's new and persistent, consult your doctor. 10. Frequent calf or ankle skin indentations, tracks from socks or shoes that deepen rather than fade. Elsa from Vienna notices her orthopedic shoes leave deeper lines than ever. She laughs about aging socks, but her husband asks why those marks are still there. Persistent pressure and fluid retention combine to cause deeper marks. It's a subtle clue. Check with your doctor, especially if other symptoms appear too. 11. Changes in skin color over the lower legs. Red-purple patches, darker discoloration, or pale cold areas. In Brussels, Marcel looks down at his legs one evening and notices a mottled purple-red hue around his ankles. He thinks maybe he bumped himself, but there was no bump. Poor circulation leads to blood pooling and irritation in the tissues, which causes color changes. Especially if this color change is new, mention it to your doctor. 12. Reduced ability to wear shoes or socks comfortably. Shoes feel tighter even though your feet haven't changed size. Sofia in Madrid buys her usual loafers in summer and returns them within a day because her feet feel squeezed. She wonders if they've swollen overnight. Hidden fluid retention expands your foot and ankle circumference. Your shoes don't fit like before. If it's new and unexplained, talk to a medical provider. It's not just about swollen ankles or cold toes. It's about giving your heart a fighting chance. When heart failure is caught early, treatment, lifestyle changes, and monitoring can improve your quality of life, reduce hospital visits, and extend precious years. In plain English, treating these signs early is like fixing a car when you hear a squeak, rather than waiting for the engine to stop. Remember Sophie in Berlin? Her swollen ankles might have been shrugged off as just aging. But with prompt action, she gave her heart a chance to stay strong, and her evenings could continue to be wine on the balcony, not nights in a hospital room. So what can you do? Let's make this practical, with a little European flair and a sprinkle of humor. Elevate your legs for 15 minutes after dinner. Luca in Rome. Put your gelato spoon aside and prop your feet up. Weigh yourself daily. If your weight jumps by 1 kilogram or 2 overnight, call your doctor. Even if you had an extra croissant in Paris. Watch your socks and shoes. If your loafers feel tighter or your socks leave deep lines, pay attention. Check your skin. Is it shiny, discolored, or tight? Note it down. Move your legs. Even a casual stroll in Vienna's park helps circulation. Stand up every 30 minutes if you're seated. Limit salt and stay hydrated. It helps reduce fluid retention. Yes, even cutting back on the salty brine in your tapas helps. And finally, keep communication open with your doctor. Bring this list of symptoms and mention if you have several. Don't panic, but don't ignore. Think of yourself as a detective of your own body. Maybe you're thinking, I'm 78, of course my ankles swell after gardening in my French cottage. I understand. Aging brings quirks. But here's the difference. What if your swelling isn't just aging, but a message that your heart needs attention? We're not talking horror stories here. We're talking awareness. We're talking giving yourself permission to ask, okay body, what are you trying to tell me? And yes, there's gentle humor in it. Maybe your feet are staging a mini protest because you forgot about them after work, or you sat too long reading letters from your grandchildren. But when that protest comes with other symptoms from our list, then you owe it to your future self to pause and check. Here's a quick checklist to remember. Ankle or foot swelling with a dent when pressed. Unexplained weight gain of 2 kilograms or more in a few days. Legs feel heavy or cramp easily. Feet cold or tinted blue or purple. Skin on your lower leg looks stretched, shiny, or discolored. Shoes or socks tighter without a clear reason. If you have 3 or more of these, especially together, it's time to book a cardiology checkup. Call emergency or go to the hospital if you experience sudden breathlessness, chest pain, or fainting. These are signs of acute heart failure. So here's the gentle takeaway. Your legs and feet are not just servants carrying you through life strolls in Prague, Bordeaux, or Copenhagen. They're messengers. They tell you when your heart could use a little extra care. And by listening, really listening, you're giving yourself the chance to walk into another sunset, to laugh with your grandchildren, to enjoy that €5 gelato in Rome, to walk barefoot on Spanish sand and feel the cool tide on your toes without that heaviness in your limbs. If you found value in this, if one small sign resonated, do yourself a kindness. Pause, check, and call your doctor. And if you know someone, a parent, an aunt, a friend, maybe send them this video. We at Wise Well believe in caring, in catching early, in living fully. Thank you for being here. Stay warm, stay curious, and above all, stay well. If you like this video and want more senior health tips, gentle humor, and real conversations, hit the like button, subscribe, and ring the bell. In the simplest, kindest way possible. Until next time, I'm your host from Wise Well. Take care of your heart, take care of your feet, and keep walking softly and confidently into each new day.
Hold up, if you care about your health, don't skip this. Healthy Buddy's top picks are Here Clean. Trusted products that help you feel better every day. More energy, better sleep, stronger you. Check them out now, your body will thank you.